Just to make sure, we also have the auscultation of gastric content. No? When we say auscultation, we're going to listen, no? Auscultate yung ating air na i-introduce sa tube. No? So I will be connecting this aseptosyringe. Aseptosyringe ang tawag dito. Alright? I will be connecting it, alright, with the use of the stethoscope. I will be placing the stethoscope on the upper left quadrant of the abdomen. Pag sinabi mong upper left, so kunyari yung abdomen niya, no? So divide it into 4. This is the upper left, this is the lower left, upper right, lower right. So upper left daw ako. Kasi remember, yung ating stomach nandito sa left side. Okay, letter J. You still remember your anatomy. Okay? So dito ko siya ilalagay. Position, upper left. Okay? And then I will be introducing air. At least 3 times para sure ka. Okay? As you introduce the air, you should be hearing for the gurgling sound. Okay? Kruk, kruk. Hindi naman yung parang manok, no? Kruk, kruk. Alam niyo yung parang nagugutom ka?
Yes, ma'am.
Oh, yung gurgling sound. Kruk, kruk. So, 3 beses para sure lang tayo. Okay? So, if you hear that sound, you are on the right position. Okay? So, since tama na yung position natin, no? So, I'm going to disconnect this one. Aseptosyringe. You have to lock it or close it like this. And then, I'm just going to put some micro-4K. Pero actually, ang gamit nila doon is a leucoplast. Ito, brown. Leucoplast. Okay? Okay, leucoplast na natin. So, paano po namin siya dinidikit? Kukuha kami ng leucoplast. So, pwede nyo i-prepare na yung tape natin ahead of time before the procedure starts para po hindi dumidikit sa inyong gloves. Okay? So, ilalagay ko lang siyang ganyan sa ilong. And then, papasok ko sa gitna ito, doon sa pinat ko, pasok mo lang. Ay, ikot mo lang. Ayan. Huwag mong tatakpan yung butas. Ikot sa tube. Okay? And then, para po at least talaga secured siya, ang ginagawa namin, tinetape pa namin pa ganon. Pero wag na natin. Okay?
Sorry.
Okay. So, and then after that, ayan na, tapos na tayo. So, ngayon mag-feed na tayo. No? Kunyari, it's time for feeding. No? So, usually, ang feeding ng mga patients natin, depende kasi sa order ni doctor. But usually, every 2 hours ang feeding. Okay? So, first is that, of course, you have to prepare. Sa feeding po, ang gagamitin na naman po natin is the aseptosyringe, the OF, the osterized feeding, and the water, plain water. And of course, the stethoscope. Alright? So, next is that, after preparing, you have to check the doctor's order na on when to feed and for how many cups of OF will be given. Okay? And then usually, you have to take off the oral osterized feeding out of the fridge, no? Siguro mga 30 to 1 hour before the feeding time para po to warm the feeding. Huwag nyo na pong lagay sa microwave para uminit, no? Kasi minsan sobrang init niya, hindi natin namamalayan, no? Sa loob pala, sobrang init, napipig natin. So may possibility ma-injure si patient, no? So, pwede po kailangan i-warm temperature natin siya, room temperature. Siguro ilabas nyo 1 hour before the feeding time, okay? Usually kasi ang mga nutritionist or dietitian po, sa loob ng isang araw, ibibigay niya lahat yung feeding niya, okay? Minsan ang bigay. So, meaning kung every 12 hours siya sa 24 hours, every 2 hours siya sa 24 hours, ilang cups ang ibibigay niya sa'yo? Ilang cups? 24 hours yun, every 2 hours. So, ilan? 12 cups po ang ibibili niya na sa'yo. So, pag bigay niya sa'yo, kung hindi pa hindi pa papakainin, ilalagay sa
Ref.
Okay, sa fridge po. So, kapag kukunin na, kapag feeding time, 1 hour, ilabas mo lang yung isa. Kasi usually po, itong mga osterized feeding, meron pong milk. Kaya baka masira siya kung hindi mo i-fridge. Okay? So, assuming, warm na siya. So, to check lang, kumuha lang ng small amount, pwede mo i-check sa wrist mo. Okay? Kung may food thermometer ka, mas maganda. Okay? And then after that, every time you feed the patient, you have to place the patient on a semi-fowler position. Pakitaas po. This is to prevent
Aspiration.
Sige po. hours, 45 minutes. Ayan. Sige ma'am, okay
Tama
na.
na.
Okay? And then next is that every time you feed, check the patency of the tube. When I say check the patency, check ninyo kung nasa tamang lugar siya. No, ma'am, what if every 2 hours ang feeding? Ibig sabihin, every 2 hours before feeding, gagawin ko to? Yes. Okay? Every time you feed, before feeding, check the patency of the tube. No? So I'm going to check it first. So I will be using, first is the auscultation of the gargling sound. So I will be connecting this one, a septal syringe. Okay? And then I will be placing the diaphragm on the upper left quadrant of the abdomen. I'm going to introduce air 3 times. We are on the right position. So the other one is aspiration of gastric content also. I will be inserting the syringe. Pull back the plunger to aspirate, okay, or to see if there are any backflow, yellowish secretion from the tube, meaning you are on the right position. So if you have the right or positive patency, so the right position, we're going to feed now the patient. So you have to maintain the height of the NGT. You have to maintain the height, of course, all throughout the procedure. So meaning talagang nakataas po siya, hindi nakababa. Kasi mahirap nga naman po paakyatin po nakababa. So itataas natin. So first, I'm going to connect the septal syringe. If I'm going to open this plunger niya, no? So if I'm going to open it, I have to kink it. Pag sinabi kong kink, i-fold mo siya. Okay? Open it para po walang air na pumasok. Kasi every time po na naka-open niya ng ganyan, kakabagin si patient natin. Lahat ng air papasok sa kanya. So, every time you open it, you have to kink it. Okay? Yung iba, forceps po ang gamit. Pero mas mabilis po pag kink ka. Okay? And then, insert this one. So, pag naka-insert na, pwede mo na ibaba. Okay? Since nandito naman itong bulb. Okay? So, I'm going to pour first 30 cc of water. So, kink it, remove the bulb. Alright? 30 cc of water first. So, meron pong measurement dyan. Ayan o. 30. Okay? So, 30 cc of water. This is for flushing muna. Di ba minsan pagkakain tayo, inom muna tayo ng tubig. For flushing purposes. Release. Let it flow. When you reach 10 cc, hanggang dito po, 10 cc. Kick it again. Get the OF. And now, pour at least 3/4 full of the septal syringe hanggang dito. Okay? So, and then, release. Let it flow. Medyo mabagal yan. Kung gusto nyo po medyo sa tulungan siyang bumaba, mabilis, pwede mo pong gawin to, i-push. I-press-press nyo ng konti-konti para bumaba agad. Okay? When you reach 10 cc again, kink it again. So, meaning hindi nyo dapat ina-empty ito para walang air. Okay? So, 10 cc na. Kung may natira pa tayo doon sa cup, ibuhos nyo lang. Okay? And then, let it flow. So, when it reaches 10 cc again, kink. And then, the last one is water again for flushing. 30 cc of water. And, release. Let it flow until actually it empties the tube na. Now, i-empty na talaga natin ito. Pag empty na siya, remove this one. You have to clamp or close it. Clamp it or close it. And then you have to place this NGT on top of the head of the patient. Okay? And then you have to let the patient stay on this position for about 30 to 45 minutes. Ganyan ang position niya. Okay? This is to prevent
Aspiration and vomiting.
okay, aspiration or prevent din yung backflow, okay, ng mga kinain niya. Kasi baka magsuka-suka siya. Alright? So, ganyan lang po for 45 minutes. After 45 minutes, you can now put the patient on its position. Supine position. Ayan. So, kapag sinupine position mo naman siya, you have to put the head of the patient on one side muna. This is to prevent aspiration just in case lang na mag-vomit pa siya. Alright? And then just do the aftercare, remove your gloves, do the hand washing, record, and report. Question for NGT.
Hindi
Yes.
po tatanggalin.
Hindi yan. Hindi tatanggalin po yan. So, usually ang NGT po is 2 to 3 days kailangan pinapalitan. But dito sa Pilipinas, hanggat nandyan yan, hanggat hindi nawawala sa lugar, hindi po pinapalitan.
At paano po
Pero
yun?
what if nawala siya sa lugar, automatic po you have to pull it. Tatanggalin mo. Okay, then insert ka ulit. Hindi po pwede natanggal siya, tapos insert ka ulit.
Ma'am,
Ng
kapag
ganito.
ka nag-insert na, same side din siya? or
Pwede sa
different
kabila.
side?
Pwede naman sa kabila.